Hello, my name is Joseph Herrera. I am a social worker with the Geriatric Neurobehavior and Alzheimer's Disease Center. Today, I'm going to talk to you a little bit about COVID 19 and how that has affected the ability of the caregiver to continue providing the services that they do on a daily basis. The COVID 19 pandemic has placed additional responsibilities on the caregiver and additional stresses, which result in additional stress, anxiety, and depression. As a result of the health crisis, caregiver and care receiver are now isolated in their own home due to the quarantine, which has created an additional set of circumstances for the caregiver. So, one of the things that can ease that stress is staying informed. Staying informed is very important because it allows you to know relevant information and updated information about the COVID 19. I think it's important to not spend your entire day watching news or navigating through the internet looking for stories about the COVID 19. Remember that not everything that you see on the internet is true, and it will place additional stress on you. Stay focused on your personal power. So, what is it that you can do? What are some of the things that you yourself can do at home? So, focus on your personal power. What can you do? What abilities do you have over the quarantine? What things can you do to maintain the person with dementia or the person you're providing care for calm and collected, and yourself as well? So it is important now that the routine has been turned upside down to you maintain a routine at home. So if you don't have a routine at home, the patient will not have a lot to do, and they'll have a lot more time to be bored. That boredom will lead to aggressive behaviors. Remember that it is important to communicate effectively with the person, but the routine is very important. So if now that the person is at home with you 24/7, they are unable to go to the senior center, they're unable to engage in meaningful activities outside of the home, you aren't able to take a walk, you aren't able to do the things that you normally do, it's time to create a new routine. So schedule daily activities from the time that the person is up and running in the morning, starting with breakfast, and ensuring that all the activities that you schedule are done or performed daily at the same time. Also, schedule time and relaxation. It is important to you to schedule rest and relaxation for the person that you care for and for yourself. It is important that you recharge your battery and that you do the things that you need to do to take care of the household as well. If you live in a household where there are more people, different generations, that will create a situation where the patient will be a little bit more confused, a little bit more agitated as a result of seeing more people in the home. It's not part of the routine. And the most important thing is to do at least one positive thing for yourself. Do something nice for yourself. It doesn't have to be a great thing. It doesn't have to be something where you spend a lot of money, but do something nice for you. Taking a bath while somebody else is watching the person that you care for. Watching a movie, making a phone call to a friend. The options are open for you to do one nice thing for yourself. As I was stating before, it is important to stay aware of the situation. What is going on with COVID in your community? What is going on in your city, in your state? Is important to be informed. Be familiar as a result of that. Also, you need to be familiar with your local services, your medical provider, the medical provider for the person you care for, and also health resources. So what is available in case that you or the person comes down with the disease? Where can you get assistance? Where do you call if you have a medical emergency? So it's important to have a plan with numbers for your provider, numbers for information, anything that you think is important that you can get to as quickly as possible in case of an emergency, short of calling 911. Of course, if it is an emergency and you need to call 911, it's important to do so as well. Avoid spending a lot of time reading unofficial information on the internet, or listening to news excessively can stress you out, can cause a lot of anxiety, and most of the information is not confirmed, is not verified, and therefore it's not something that you should be taking seriously as well. Be open and honest with your family. So if you have questions, if you have concerns about the COVID-19, if you have questions about infection or potential for somebody in your household to go out, get exposure, and then come into the house and expose yourself or the person you care for, make sure that they know that the person with dementia or the person that has a medical condition are at a higher risk for developing the disease. It's important that everyone is on the same page. It is important that you keep a list of important numbers. Your provider, the person you care for's provider, power of attorney, if you're not the holder of the power of attorney or the designated person, numbers to close friends, to people that you rely on for additional care, and have it posted on a central place. Most people recommend the refrigerator. It is a good place because if you need to call 911 or if somebody needs to call 911, all that information will be posted on the fridge, list of medications and additional information that you think is important for first responders. Don't sit at home waiting for something to happen. Join an online group. There are several agencies and organizations that are providing services via video platforms that you can connect to or join with your phone or your laptop or PC at home. They are providing group information or support groups, education. They also provide support, one-on-one support via telephone as well. So make sure that you have a list of those resources as well, so that you can, in a moment when you're stressed or anxious and don't know what to do, you can contact them so that you can find some relief by talking to somebody who might have an idea of what it is that you're going through. Request and accept assistance. I know that a lot of caregivers, in my experience, the hardest thing for them to do is to pick up the phone or to talk to somebody in their household about needing assistance. It is important that if you feel that you are having an extra hard day, or your level of anxiety is high, or that maybe things are not going too well that day, that you have somebody that you can call. So make sure that you call for assistance. Make sure if somebody calls you, by the same token, offering assistance, that they get to you and that you say, yes, I need assistance, please help me. It is not below you as a caregiver to accept that assistance that somebody else is willing to provide. Reach out to neighbors and friends. I know that it is a little bit harder now because of COVID to get out of the house and have face-to-face contact with people, but you can call them on the phone, or if you are able to use a video platform, you can set up a meeting to drink coffee, to talk about your favorite shows, or just to talk about the state of affairs. It is very important that you stay connected to people outside of your home. Also, if you have a mobile phone, or if you have a Facebook page or any social media platform that you prefer, that you stay in contact with your friends and with the people that you normally are in contact with. It's very important, and that will give you a little bit of a relief to the doldrums of your day-to-day